Hello, everybody, and welcome to this week's episode of Medisodes. Since we're so close to Christmas, we thought it would be apt to do an episode covering the effects of Christmas on healthcare. Christmas is a time for family, friends, and of course, presents for many. But what people do not often consider is the effects of Christmas on the health and the healthcare system. To begin with, I'll go through some examples of how Christmas affects people's physical health. To start off with, I'll talk about COVID-19, and if you want more information on the latest situation of COVID, be sure to check out Medisodes episode 44. Over Christmas, people will be mingling a lot more. This increases the risk of transmission. More people in closer proximity with each other means that airborne particles containing COVID-19 particles can transmit from person to person more easily. Furthermore, the run up to Christmas often involves lots of shopping, and shops, as we all know, are enclosed spaces indoor. With increased amounts of traffic inside these shops, this increases the risk of transmission too. This is a contributing factor as to why we see a spike in the cases of infectious diseases such as the flu every year around this time, and it's no different with COVID-19. So in order to keep ourselves protected against COVID-19 this Christmas, we need to make sure to minimize contact with people as much as possible, and make sure to wear masks and make sure we sanitize our hands. Impact of Christmas on healthcare is the increased alcohol consumption. Alcohol is often consumed in much larger quantities over Christmas, with sales increasing drastically during the festive season. First of all are the direct impacts of alcohol on health. People can be inclined to drink more than they would do at different times. Since alcohol consumption is much greater over the Christmas period, people are likely to be more drunk than usual and that they are used to. And this may mean that they face unexpected situations, such as finding that they're not able to walk home safely and being so drunk that they choose to drive, which is obviously very dangerous. Things like these increase the risk of accidents and other mishaps, which often leads to many patients having to go to A&E for the latter part of Christmas, which ultimately is something that everyone wants to avoid. In addition to this, the indirect impacts of alcohol are also quite visible. Some people may have an alcohol problem and over Christmas may struggle to control this. And for some people, a sudden increase in drinking alcohol can cause liver problems and ultimately increase the risk of liver cancer later down the line. So Christmas brings a lot of physical health issues. Alcohol is one, COVID-19 being another, and of course, with many people being happy to see family and friends after a long time exchanging presents and whatnot, it's important that we take care of ourselves to ensure that our health is good and that we can enjoy the festive season all the way till the end. As much as I've talked about physical health, and it is very important, mental health is often not discussed enough during Christmas. To talk more about that, I'll hand over to Surya.
Whether or not Christmas is a part of your life, your mental health might be affected by Christmas happening around you. It's a time of year that often puts extra pressure on us and can affect our mental health in lots of different ways. Loneliness during Christmas can have a big impact on mental health. Not having people around us can feel more difficult at Christmas when there are lots of images of families and friends together. Even if you have a lot of people around you, you can still feel lonely. This might be because you feel you have to hide your feelings or be a different person around some people. If you are a carer or have a mental health or physical health problem, you might also feel like you cannot join in with all the celebrations. If you have to spend Christmas in a care home or hospital, this can also feel lonely, particularly if others around you have been able to leave for Christmas or have people visit. You might also feel alone or left out because everyone else seems happy when you're not, which can also impact your mental health. Financial stress during Christmas can also have a heavy impact on mental health. For example, not having enough money or being in debt means you might not be able to handle the extra cost and pressure to spend money, for example, on presents, outfits, or food. You might also have to work during Christmas and have to work when children are at home, and being unable to spend time with them can impact mental health. Being in hospital during Christmas could also impact your mental health for many reasons. Different hospitals will do different things during Christmas for those who have to spend time in hospital. This can make it difficult to know what your Christmas will be like. If Christmas is already a hard time for you, It might feel more difficult than usual if you need to spend it in hospital. Visiting rules might be different at Christmas depending on where you are, and you might not want people to visit you, or you might have people in your life who won't visit. There may be fewer staff or different staff to the ones you are used to. There may also be fewer people on the ward if some people have been able to go home for a short period of time. There are also a whole range of other reasons why Christmas might impact your mental health. If you're not in contact with family members that you celebrated Christmas with last year due to relationship issues, Christmas might trigger negative emotions. You might be going through a time of bereavement because someone has passed away, and this could mean that you're not able to enjoy Christmas like everyone else. If you or someone else close to you is unwell or has a health problem, this might mean you need to spend Christmas apart. Your experiences of last Christmas during the corona restrictions might affect how you feel about this Christmas. If you already have a mental health problem, it could become more difficult to deal with during Christmas due to the following reasons. Difficult and stressful experiences at Christmas could make your mental health worse. For example, enjoying Christmas might also affect your mental health, for example, if it triggers hypomania or mania. It can be harder to access services that normally help you regarding your mental health, and some of these services may be closed during Christmas period. So hopefully this has given you a brief insight into how mental health can be impacted by Christmas.
While many of us will be tucking into our Christmas dinner with our family on Christmas Day, over 400,000 NHS staff will be at work, and these consist of over 100,000 nurses, over 60,000 nursing assistants, 12,000 midwives who deliver 1,400 Christmas babies. There's also 12,000 ambulance on standby and 176,000 care workers who visit those that perhaps don't have anyone with them on Christmas Day. And also, we have to have a big shout out to the caterers who produce over 400,000 Christmas dinners every year for patients and staff. The Christmas Day staffing is decided with the general rota that doctors are on. And usually, if you stay in the same hospital, there's an informal agreement that if you take one Christmas, if you decide to be the person to go in on Christmas one year, you shouldn't have to go in the next year. However, if you've read Adam Kay's book about Christmas on the wards, you'll know that if you're switching between hospitals, that's not how it works. And you could end up doing Christmases for multiple years. It's a reduced service on Christmas. So there's obviously no regular appointments because who would want to go to a doctor's appointment on Christmas Day? There is, however, existing patients on wards. Obviously, if you need to be kept in over Christmas, that's very important. And the staff will make sure that you feel as comfortable as possible. Many staff may come in with presents, chocolate, stuff like that for patients. They'll have Christmas decorations around the ward. It'll be a much more fun atmosphere than normal. And they should, for example, they might do some caroling, they might do different Christmas games perhaps, and perhaps it's more relaxed than. However, there's also the emergency department, and as Adrian said, there's many incidents perhaps on Christmas Day and New Year's Day as well, and especially due to alcohol, and it's very important that emergency departments stay open. However, the NHS has issued a list of things that you shouldn't come into A&E for, minor things like if you're sneezing or if you've got cuts or something like that that doesn't actually need medical attention you can do at home. Ideally, you should do that. And if you're unsure, there's NHS 111 as well, 24/7 phone line. So that's also can give some good advice on what to do. Usually, a lot of GP surgeries might not be open because Christmas Day is treated like a bank holiday. So many of the staff will be off. You still can get in touch with your GP. Phoning them, you should go to the answering machine and they should be able to get back to you. However, specifically for this year, there are some concerns with staffing. The BMA, which is the doctors' trade union, has warned that there might be staff shortages due to the Omicron variant, which we discussed in our COVID update episode. So they've done some modelling. In their best case scenario, where cases double every 4 days, this could see about 30,000 NHS staff off because they've tested positive. In the middle, the realistic case is doubling every 3 days, and that creates 50,000 staff off sick just in England due to testing positive for COVID-19. And in the absolute worst case scenario, it's cases double every 2 days, and that could lead to 130,000 NHS staff off work. And if we think that the total workforce in the NHS is about 1.3 million, that means 10% of NHS staff will be off after testing positive for COVID. But we also have to consider, on top of these numbers, the fact that if you're in contact with someone who's tested positive, you also need to isolate for 10 days. That would make it even worse. The BMA has asked the government for pre-Christmas COVID restrictions, such as a return to social distancing. And it's very important that we've clapped for carers throughout the pandemic. The best way to show them that you care for them is the fact that you should be careful who you mix with, limit your gatherings, and you should try and prevent the spread of COVID, because ultimately that's what's going to help them do their job better and make sure that they stay healthy and they're able to deliver for their patients. So that's how staff deal with Christmas. Now let's look at the fact that Christmas has a massive financial impact on the NHS.
Financial impact of Christmas on the NHS and winter in general is vast, to say the least. And in recent years, coupled with the global pandemic that is occurring, the UK government has had to spend increasing amounts on the NHS during this period of time. A lot of it is for the reasons we've discussed so far, that being the increase in health risks during the winter period, and a lot of it also comes down to the staffing shortages that can occur. This year, the government has announced a whole host of new measures to sort of support the NHS during this period. This includes £55 million that have been invested in ambulance services to help boost their staff numbers ahead of winter and counteract those shortfalls, as well as £75 million to increase 111 call handler and pathway clinician capacity. By boosting these auxiliary services, the hope is that the NHS isn't as badly understaffed as in previous years. And it also allows for better access to primary care over the winter. This is also being boosted by the £250 million Primary Care Winter Access Fund, which aims to enable GP practices to employ more doctors and other staff over the winter period. It also aims to supplement existing recruitment and retention schemes, some of which I'll come on to later. Mental health, another thing that suffers a big dip during Christmas due to the skies getting darker much quicker, adding on to a whole host of other seasonal related mental health disorders. To combat this, the government is spending £48 million on mental health services between now and March, which will support people with mental health needs to stay well at home and to reduce long waits in A&E. The government also announced in this September the Targeted Investment Fund, a package of additional funding to support the NHS for the second half of this financial year until March 2022. This £700 million Targeted Investment Fund was established to support NHS systems and help them ride out not only the current COVID-19 pandemic, but also the seasonal effects of winter and Christmas. Funding was allocated on a regional basis based on population. This includes £112 million in the northeast of England, £97 million in the northwest, £109 million in London, £69 million in the southwest, £105 million in the southeast, £78 million in the east of England, and £131 million in the Midlands, the largest region. Of this £700 million, £330 million will be invested in NHS estate, and a further £250 million will be spent on digital initiatives that aid recovery efficiency and reconfiguration. A further £120 million will support associated or additional revenue costs. The government has also sought to support a bunch of high-value schemes run by NHS trusts that exceed £5 million, including a £13.8 million investment in new wards at University Hospitals Birmingham, which delivers an expected 164 additional inpatient beds, £10.2 million to develop a new South Mersey elective hub with 2 new operating theatres and recovery areas, £7.4 million to construct 2 new modular operating theatres with supporting anaesthetic rooms and recovery space at Guy's Hospital in London, and £5.9 million at Bedford Hospital to create 20 flexible multipurpose outpatient rooms. These are just some of the programmes being supported by the government.
The government is also looking at healthcare beyond their secondary care and hospital facilities. For adult social care, the Department of Health and Social Care has announced the Winter Plan for 2021 to 2022, setting out the actions national government will be taking to support the sector. This includes providing £388 million in further funding to support infection prevention control, testing, and vaccination uptake in adult social care settings. £25 million of which has been specifically made available to support care providers and social staff to deal with the costs associated with accessing COVID-19 and flu vaccinations. As well as this, targeting social care workers, the government has also announced a new £162.5 million workforce recruitment and retention fund to help provide additional support to the social care sector ahead of winter and to try and retain more key workers in a time where there are often shortages. On top of all this, the government has also spent an additional £150 million on a wider NHS workforce retention fund. This aims to curb staff shortages in other areas of the NHS, including hospital and GP staff. All in all, the government has seemed to spend big this year on the future of the NHS. However, with COVID cases going back up, especially with the new Omicron variant, and the likelihood of another lockdown on the horizon, it remains to be seen whether this spending will be enough, or if the government is going to have to spend even more on their health facilities.
We've discussed the impacts of Christmas on various aspects of healthcare, from physical health, mental health, staff, and the financial impact of it on our healthcare system in the UK. So I hope you've enjoyed this week's episode, and be sure to tune in next week where we have another episode of Medisodes. Be sure to like, subscribe, and share this content with any of your friends.